Hi, I'm Dr. Bushra Khan. I'm a consultant in surgical oncology at Star Hospitals. Welcome to the 16th episode of Let's Talk Health. Today we have with us Dr. Anusha Mandava, consultant radiation oncologist in Star Hospitals. Our topic for today is infertility treatments and its impact on women health. So, Dr. Anusha, what exactly is infertility?
So before we begin the topic, it's very important that we learn the definition of infertility. American Society of Reproductive Medicine defines infertility as failure to achieve pregnancy within 1 year of unprotected intercourse in women aged less than 35 and or within 6 months in women aged more than 35. So we are seeing in India a rising trend in infertility rates. It was about 13% in 1980s, which has risen to about 20% in 2020s. So at any given point, about 15 to 20% of couple are deemed infertile. Globally also there is rising trend with about 1 in 6 people being infertile. So it's definitely the infertility rates are on the rise. So what do you think are the reasons for this rise in infertility rates?
So, whenever we talk about infertility as a society, we feel that infertility is always attributed to women or females. So, I would like to tell everyone that no, male infertility is on the rise too. About all of the couples, if we look at it, around 30 to 40% of the cases are attributed to male infertility. So, if we look at the causes, let's divide it into two broad groups. One, the non modifiable risk factors, and two, the modifiable risk factors. Looking at the modifiable risk factors, what I'd majorly like to comment on is the lifestyle today. Excessive smoking, excessive alcohol consumption, not paying attention to your diet, rising trend of obesity, weight gain, and other drugs consumption as well. It is very important that because of these risk factors, even lack of sleep, inappropriate like sleeping patterns, excessively getting involved in stressful activities is contributing to infertility being on the rise. If we look at the non modifiable risk factors, one of the major causes is late marriages. With increasing age, the fertility decreases, and that's why also there's a rising trend in infertility, even in India today. Other other non-modifiable risk factors include various endocrine diseases. It could be any sort of reproductive tract abnormalities. It could be attributed to any sort of genital tract infections, any testicular disorders, any ovarian insufficiency. So now that we know that infertility is on the rise and we know the causes, what exactly are the treatment modalities that are being used for infertility today?
So the infertility treatment techniques or the assisted reproductive techniques, there are various types. The simple ones being ovulation stimulation. The other various IVF or in vitro fertilization techniques include GIST, GIFT, ICSI, and intrauterine insemination, intrafallopian transfer. So there are multiple techniques that are available. When we come to IVF, that's the basic IVF, the fundamentals remain the same and there are various steps involved in it. The first step would be suppressing the normal menstrual cycle. The second step is mainly controlled hyperstimulation of ovaries. This is done by certain medications called the gonadotropins, which causes stimulation of the ovaries, which in turn causes about 8 to 12 mature follicles to be developed. So this follicle development is traced or tracked regularly by ultrasound and blood hormone levels. At a certain level, what we call when they are ready for egg retrieval, a trigger shot is given with injection HCG. So following this injection, they wait for 36 hours and an egg retrieval is done. Multiple eggs in fact. So once this egg retrieval is done, there's simultaneously semen analysis is done and there's a fertilization done outside the body and embryo transfer is done with progesterone support or the luteal phase support basically. So what happens here is generally we know that each follicle has a capacity to produce 200 picogram per ml of estrogen. So in this controlled stimulation of ovary, what happens is about 8 to 12 follicles are generated and each has a capacity to produce this 200 picogram per ml. Normally in a woman, the blood estrogen levels varies between 40 to 200 picogram per ml. So, with this raised controlled stimulation, the blood hormone levels can go as high as 2000 picogram per ml.
So, Dr. Anusha, can you tell us what impact does even normal levels of estrogen have on our body? And with such high levels, what is happening? And why we, being in the cancer department, like cancer specialists, why are today we talking about infertility treatment so much?
So basically, estrogen we know is a female reproductive hormone. So estrogen is mainly a female sex hormone. It has effect on various reproductive organs. Basically, it causes maturation and maintenance of uterine and vaginal epithelium, and it causes stimulation of the ovary, like I discussed earlier. So it mainly causes proliferation of the inner lining of the uterus and preparing it for the implantation of the egg, fertilized egg. The other thing is with growth hormone and insulin like growth factor, it plays a major role in development of breast at puberty and also during pregnancy and lactation. Even during regular menstrual cycles, the ductal component of the development within the breast happens because of this estrogen. When such high levels of estrogen are present within the body, these, especially breast and uterus, are subjected to overstimulation. This can in long run lead to hyperplasia.
Yeah.
So, does that mean that all the IVF procedures are unsafe, or what are the precautions that we can take?
So, like Dr. Anusha has already emphasized on the various assisted reproductive techniques, and with infertility being on the rise, definitely these ARTs are important. They're essential to actually undergo treatment and to help out couples. But one thing that all of you all need to understand, what we need to put out there, is that before you go ahead with infertility treatments, make sure that you bring about adequate lifestyle modifications which ensure that you are in adequate fertile health before you go ahead and you deem yourself as infertile. So very importantly, eat right, make sure that your weight is under control, avoid smoking, avoid alcohol consumption, avoid drug consumption, make sure you have an adequate sleep routine in place, like you're sleeping 8 hours, you have adequate mental and physical rest. Before you go ahead with these infertile treatments, make sure you have the right lifestyle modifications that are required for optimum fertility health. The next thing is that once you start treatment with a gynecologist or your infertility specialist, it is very important that you do not jump from one doctor to another without being informed of what exactly you're undergoing. Do not hide your history of previous fertility treatments from your next doctor, and make sure that you complete the treatment in totality as explained by your infertility specialist. At the same time, it is very important that when you are going ahead with these infertility treatments, you have an informed consent of what actually you're getting into, the timeline, the period, what precautions you need to take, what preventions you have to go ahead, and even once you conceive with these methods, post delivery, the treatments and the screening that you have to ensure. So, it is an entire process. And now, can you, Dr. Anusha, emphasize on which all cancers are on the rise because of these inappropriately conducted assisted reproductive techniques, which could be like,
So basically, modern medicine today is equivalent to evidence-based medicine. So we do not have clear-cut data, especially when it comes to in vitro fertilization treatment or assisted reproductive techniques, and how it affects cancer in the long run. There's a lot of conflicting data. There are few studies which show that there is no association and few studies that show association. So right now, like you said, a major factor that plays a role is that there are certain designated number of cycles that are allowed. But when it comes to Asian population, I think a lot of patients, in the hope of getting pregnant, are hiding these previous treatments. So, and subjecting themselves to a lot of repeated IVFs, which can lead to cancer in the long run when you are talking physiologically. Like, you know, the effects of estrogen on breast, you know, the effects of estrogen on uterus. So thinking in that terms, definitely there is a positive role but we don't have any clear evidence. There's conflicting data, and whatever data is available is mostly Western, and it may not be it might not replicate, or it's not replicative of, especially for Asian population. But there are certain studies which show that, especially in women who have significant family history, the risk of breast cancer is about 40% more in people who have subjected themselves to IVF treatment. And also, we know that people who have undergone hormonal treatment for this purpose, they develop dense breast over time, and dense breast by itself
risk
is one
factor.
of the risk factor for breast cancer development. And also, within 1 year after subjecting themselves to this IVF treatment, women are at higher risk of breast cancer. So this 1 year period post treatment also is very crucial.
Okay.
So definitely, if you ask, is there clear-cut evidence? Definitely not. But there is a positive studies that are there and negative studies. I think it all depends upon how many cycles they subject themselves to
True.
over time. So what are the
Precaution.
precautions that they can take when?
So, what I would suggest for anyone who's actually undergoing these assisted reproductive techniques, firstly, be aware. You need to know about your own body and your own health. So, like Dr. Anusha has already mentioned, there are certain number of cycles that are safe, and you need to make sure that your number stays within that. And your infertility specialist, your gynecologist, is going to counsel you about what exactly the safety norms are. Now, suppose if you have gone ahead with these assisted reproductive techniques and you've conceived, what is the next thing you need to do? You need to be aware. You need to be breast aware. You need to be cancer aware. So, the first basic thing that you need to start for screening to check before any disease actually comes in is self breast examination, something which can be done at home every month, 5 days after your menstrual cycle. Please stand in front of the mirror, inspect yourself, palpate, and feel your breasts and make sure that there's no abnormality in terms of lumps, in terms of nipple discharge, in terms of skin changes, or any wound that is not healing, any pain that is not subsiding. If you are above the age of 40, make sure that you get an annual mammography done, especially if you've undergone these hormonal replacement treatments and assisted reproductive techniques. Very importantly, you need to be very well aware of your family history. Anyone who has a family history of breast, uterus, or ovarian cancer, you need to be aware of it. You don't need to be in fear, you don't need to be scared, but you need to be aware. As such, there is no protocol for screening of uterine and ovarian cancers. But in case you develop any symptoms, for ovarian cancer, you could have symptoms of abdominal pain or bloating, even constipation. Non-specific pain can also be present. For uterine cancer, it could be anything which could range from mid-cycle bleeding to post-menopausal bleeding. Any spotting which is abnormal, which is not normal, definitely get yourself checked. Any pain which is not specific. What is important after undergoing these assisted reproductive techniques is that you need to be aware of your body, you need to be conscious, you need to get screened for cancer. So, in conclusion, Dr. Anusha, what exactly would you tell everyone out there in relation to these infertility treatments and cancer?
So basically, motherhood is as equivalent as a feminine identity, and also it's one of the most desired outcomes for couple motherhood. So this childlessness has a lot of social and psychological stigma associated with it. To all the women who are considering infertility treatment or assisted reproductive techniques, please put your health before subjecting yourselves to these techniques or treatment procedures. Be informed about the possible side effects, what are the success rates, and do detailed
Research.
research about it. And also, I think it's very crucial, as instructed by International Society of Fertility Preservation, in women less than 35 years of age, the safe number of cycles is 4, and between 35 to 49 years of age, it is 1 to 2 cycles of IVF treatments, whatever be the method of IVF. So please don't subject yourself to extreme physiological stress in the name of motherhood.
Yeah.
I
Don't
think
fall into the society
Yeah.
pressures or
Yes,
peer pressure.
I think your health is equally important, and wherever possible, if the number of IVF cycles is on the rise, like you have already taken 3 or 4, don't consider further the same treatment. Change the type of treatment that you are receiving.
So,
Yeah.
thank you.